Hi, this is Chris from the CPAP shop. We're here with Dr. Brandon Peters. Dr. Brandon Peters recently had the new ResMed AirSense 10 AutoSet CPAP machine for about a week and experimented with it, personally used it. We all know that ResMed is famous for making high-quality CPAP machines and VPAP machines, but before we discuss the great features and, more importantly, the auto algorithm, what was your first impression of the new AirSense 10?
So I actually was very impressed with it. I'm typically happy with ResMed's product, and this one was no different than what had been in the past. I actually have it in front of me, and it's a very sleek design, a lot of integrated features that I think patients are going to benefit from, which I think we'll talk about in some detail.
Some patients have never experienced an auto CPAP machine before, and of course that's what you tried for about a week. There's a standard CPAP machine, which just is a straight pressure of, let's just say, 10, and there's the AutoSet machine, which a lot of our patients enjoy, which will automatically adjust the pressure. Some of our patients have never experienced an auto before, and they might be concerned, how do I know that it's really working? Did you find the auto function to be proactive and equal to or better than a standard CPAP machine, or does that really differ, patient to patient?
Yeah, I typically use auto CPAPs almost exclusively for my patients because I do think it gives a better treatment. What an auto machine does and what this device does is it basically is detecting resistance within the airway. So if the airway collapses down during sleep, it detects it as an increased resistance, and it can self-adjust, turn itself up a little bit to compensate for that and be able to keep the airway open. It typically does a very good job, and these machines are designed such that it may increase the pressure slightly, and then as needed, actually back off on the pressure. So if it notices that your airway is stabilized, it may test a lower pressure and see if that stability is maintained. So it's very smart technology, and it makes for a more comfortable experience because you don't want more pressure than you need most of the time. And there may be variables during the night, so if you're on your back more, you may need slightly higher pressure. If you're in REM sleep, when your muscles are relaxed, you might need slightly higher pressure. So this machine can accommodate that and make sure that it delivers the pressure that you actually need, which tends to optimize therapy and improve overall benefit from it.
And improving overall benefit, everybody wants to stay compliant, and when you boil it all down, just have a good night's sleep. And one of the functions that a lot of companies are doing to try to make their product more user-friendly, and with that, ResMed has put onto their machine, it's called My Sleep, where you're able to successfully use that, determine AHI leak rates with the My Sleep screen.
Yeah, so as you, maybe a little hard to see here, but if you turn the machine on, there's basically an upper and a lower screen. The lower screen is the access to a sleep report, so it'll tell you some basic information about the prior night of sleep, how many hours you used it, how your mask was fitting, and maybe information about your apnea-hypopnea index. It typically is not ideal to chase that number each night, so when you come in to see your sleep physician, they'll often look at an average of 30 days or maybe 90 days, and that'll help to kind of even out some of the variability that happens night to night. So if you do see some numbers that are a little bit elevated one night, you may not worry too much about it, but if it happens night after night, that may suggest that some changes are needed either with your mask fit or with the pressure of the machine itself. But that's good information to have as you're tracking your own health and your own benefit from the device. Importantly, insurance wants to see you using this device in the first 90 days, a period of 30 days, at least 4 hours a night. Of course, you should use it through the whole night, but tracking your overall use and seeing how many hours you've been able to use it can help you to meet those early compliance goals, which will allow you to keep the device and continue to use the treatment.
Yeah, and without needing any software or a specialized computer, you have everything sort of on board already to look at, so you can spot check and kind of keep up on things. Maybe keep a ledger of, every 30 days you check it and see how you're doing, how you're progressing with with leak rate or some specific number.
Yeah, the nice thing with the biggest change with this particular model is this AirSense technology, and what that allows is for remote access to this data. So you can turn that off with airplane mode, but if it's on, what it does is it connects to a local cell tower. it can directly send that information to your equipment provider so they can make sure that things are going well. It can send the information to your physician so that they can check in if there's problems, if the pressures need to be changed. Your physician can log into a website and remotely change your settings, and that way you don't have to bring the machine in to have those changes made. So it's very much real-time, kind of integrated information gathering as well as changes to therapy as needed.
Yeah, that is a great feature, the AirSense, the remote ability to do that, and that is something that we'll be offering our patients as well. ResMed has had the EPR, which basically lowers the pressure upon exhalation, built on many of their machines. This one has it as well. Did you use the EPR? Was there a specific number that you felt was most comfortable?
Yeah, so the exhalation pressure relief, that EPR, is something they've had the last couple of models. Basically what it does is it bows the pressure back a little bit to let you breathe out more comfortably. It's not something that I use CPAP myself. It's not something I really had turned on with the prior S9 model, but with this model I did test it out, and it actually was a little bit more comfortable as you breathe out. It does noticeably drop the pressure. Actually can make it a little even more comfortable to talk if you have the CPAP on, which I know can be uncomfortable for some people if you try to do that. But it does seem to be a noticeable difference. As far as the setting, I think it's probably a matter of personal preference. It's really 1 to 3 if you have it turned on, and most people, I would say, start at 2. You could turn it up or down as needed, and if you don't notice any difference or any benefit from it, it's something you could easily turn off as well.
Probably something a little bit, maybe on higher pressures that a patient would need. If your pressure is 18 or something a little higher, maybe it's a little hard to breathe out against an 18, and rather than have the machine fight against you, it's sort of trying to work with you a little bit.
Yeah, exactly. So it almost mimics what we call bi-level therapy, which are 2 pressures: one you breathe in with and a slightly lower pressure that you breathe out with. So as long as your airway is stable during that process of exhaling, it can be a very comfortable feature and something that people find helpful.
Right. Another feature, another great comfort feature that a lot of patients need and like and helps their overall therapy is the availability of a heated humidifier. As you know, the new ResMed AirSense 10 has the heated humidifier built into it with a removable chamber that you can open and clean. The AirSense allows, with the conjunction of the heated tube, you can let the machine automatically adjust the temperature or the humidity by itself, or you can manually do that. Did you have any, what was your feedback on that? Most people find it very nice, depending on your climate. Obviously, if there's a lot of humidity in the air, maybe the heating element won't heat up as much. You can also turn it completely off and have it do the reverse effect, which would be a pass-over humidifier.
Right.
Did you have to make any manual adjustments, or did you find the auto setting just to be just fine?
Yeah, so I'm going to show you a couple things. So the humidifier is different in the sense that it's a part that kind of comes out like this rather than a separate piece that was in the prior S9 model. This is not something that you necessarily have to use. They do have a cap for the end of the device that you can put in place if you just are interested in using just the CPAP by itself. Most people are going to benefit from having humidity, so I usually recommend people at least start with it, and you can get away from it if you decide to. But the heated tubing connects at the back of the machine here. This is basically standard of therapy now. Without the heated tubing, if you have the humidifier running, you might get condensation inside the tube. You can get water splashing into the mask or in your face. So most machines, newer machines, are going to have that as an integrated element. And the auto feature I thought worked pretty well. I live in San Francisco, and the climate can be variable during this time of the year, but it was very comfortable for me. I also took over control one night and played with the settings a little bit. I think it's a matter of preference. I thought the auto function did fine, but if you are somebody who maybe you really prefer a cooler temperature, or maybe you need a little extra moisture or humidity because of allergies or other things, you may want to take over the control of that function to be able to do that. But I thought the auto function actually worked pretty well. And there's also, most people are familiar with the ramp function on these machines, where it starts at a lower pressure as you're falling asleep and then gradually turns it up after a set period of time. There's also an auto ramp function on this new device, which is a little bit different, and I think some people may benefit from that as well. It may detect the change in your breathing and be able to turn itself up when it needs to, rather than waiting a set number of minutes.
So a lot of great, user-friendly features are in there. Obviously, compliance is a huge thing with the ability to, through use sleep, to have reporting. And a lot of people are traveling with their CPAP machine, so you want something that's compact. Do you think the size of the AirSense will impact anything? Because there are, smaller units out there. Of course, they might not have all the features that this one has. Um,
Yeah, that's true. You can get travel CPAPs that are very basic. They usually do not have a humidifier as part of it. They typically are a fixed pressure machine. They often don't do bi-level or other more sophisticated treatments. Comparing the S9, which is the prior model, actually have it here. This is the blower of the S9 unit, which is fairly small. The humidifier obviously increases the size by about a factor of 2. Now the newer AirSense model here, if you look at it side by side, it's a little bit wider. So, and you can't make it any smaller. I mean, this is as small as it gets with that cap in place. So, it's fairly light and something that you could travel with. The bag itself that comes with this device is actually very nice. Very compact, easy to fly with, easy to travel with, and I think most people are going to travel with it no matter the size because they get the benefit from it. And some of these extra features I think are worth the trade-off in the size of the device.
So I guess it's safe to assume that your overall level of satisfaction is still, some high praise. ResMed does put out a good quality product. The compliance features are really nice. The auto algorithm able to detect and monitor your airway during the night and ensure that you're giving the correct pressure. All those benefits that you can have with the heated humidifier. You can use the heated tube. You don't have to use the heated tube. You can use a regular slimline tubing that they give you. It's a smaller diameter, but the ends of the tubing are the same size, so they didn't force patients into needing a specific adapter. Any mask will work with it. The machine can be used anywhere in the world. I believe it also has automatic altitude adjustments. So all these features that are built in to try to make it more user-friendly. I noticed on the screen it has a little home button, so if you get sort of lost in one of the screens, you can hit one button and it'll take you right back to the beginning. So you won't have to worry about messing anything up, I guess.
Yeah, it's true. Yeah, I think they've done a lot of things right. They've integrated some of the newest technology that I think ultimately will become the standard of care across the field. The only real negative that I noted from this machine is I don't really care for the design of the new humidifier. It's a little more shallow than the prior one, so as you fill it up, it's pretty easy to overfill it and have the water actually come out the end of it. So I would just caution patients about doing that as they're filling it, just to make sure they don't get a mess on their hands. But that was really the only major negative thing that I had from my experience using it the last 10 days or so.
Right. Well, thank you very much for your insight on the unit. And ResMed will be coming out with a bi-level machine called the Air Curve, I believe. It's probably going to look exactly like the Auto, probably a different color. And when that comes out, we'll make sure to get your feedback on that one as well.
Okay, sounds great. Thank you so much for your time.
Thank you very much, Dr. Brandon Peters. Thank you.